A common thing we see in a lot of our pain cases, our low back pain, neck pain, recurring disc issues, things like that, is an improper breathing pattern. So what does that mean? Shouldn't you be able to breathe? You're right, but most of us, we sit too much, our cores aren't engaged enough, we're not upright and tall, and we move to an accessory breathing pattern where we're using a lot of our chest muscles, the intercostal muscles between the ribs, and not as much as our diaphragm. If you're a runner, diaphragmatic breathing helps you be more efficient. If you have back pain and neck pain, it takes a lot of the stress because you're not using so many muscles to breathe. It becomes a more fluid and passive movement. So I want to run you through a progression of crocodile breathing, balancing yourself between chest and belly breathing, and then bringing your knees up for that, and then into a pelvic floor stability as well. Exercise number 1 is crocodile breathing. Basically what we're going to mimic is a crocodile. Their bellies are on the ground. When they breathe, they push in and out, and you see that big expansion. So when you're getting in this position, lay nice and flat. We're going to set ourselves up in a nice relaxed position, and then we're just going to breathe by pushing our belly into the ground, as well as trying to get the expansion on the sides as well. We want to feel this all expanding down here in the lower part of our belly. With that, that's a great exercise to start, especially if you're having neck and back pain. It's great relaxation, helps your muscles relax, helps you calm down, but also gets you into a normal breathing pattern, which is more relaxed. So try 5 to 10 minutes of that each day. See if you can get more diaphragmatic action and get a lot of this accessory, this big breath out of the way. Stage 2 of our breathing progression is lying on our back, knees bent, one hand on your chest, one hand on your belly. And what you want to do is when you breathe in, you want to feel your belly move and your chest stay still. From there, we want to bring in a little bit more of a dynamic athletic position. We're going to almost get into this dead bug position, but we're still going to keep our hands here, and we're going to still try to breathe through our belly, avoiding the big chest expansion. And then lastly, we want to bring in pelvic floor stability. So we're going to stay in this dead bug area. I would scoot closer to the wall, basically if my head was up against the wall, and I would push my hands into the wall and continue working on belly breathing. That is a pretty standard breathing progression, from crocodile breath to figuring out how to breathe with your belly, get that breath down low, avoid chest breathing, and then bringing it into a dead bug position, and then a pelvic floor stability position where we're pushing into a wall overhead, keeping our knees bent and up in the air.